in the overall landscape of medicine. It prompted me to think objectively about the value added for primary care in this landscape. And some would say that family medicine is no longer a valuable source in the landscape. Some would say that it's a relic of the past. And I would say that family medicine has a unique place in modern medicine. However, this requires us to think differently as a specialty. As family physicians, we're caring, we think about the big picture, but we often don't think about ourselves. Additionally, with everything that we know and how valuable family medicine is, we need to kind of reject that kind of gaslighting notion that our specialty isn't one of the most important in the American healthcare landscape. So why do we act like this? We have so much accumulative power, but we don't really use it. My original title of this artistic project was My Love Letter to Family Medicine. I love you, but this relationship is toxic. The primary care relationship with the healthcare system is akin to a domestic abuse relationship. And you have to ask yourself, why do you keep coming back? Now, I'm an eternal optimist, even if I'm being critical right now. And so it is a part of that conversation that I think about how can we help? How can we change the way that we interface with the healthcare system? And if you've ever had a conversation with me about the criminal justice system or Chris Brown and Rihanna, you would know that I believe in redemption and the systemic real change that is possible. So I'm not here to complain about the problem. We all know what the problems are. I'm here to talk about the solution. And my project is my answer to this sometimes abusive healthcare system.
Thank you. And I should say that after these presentations and after the panel presentation, you'll have an opportunity to kind of walk around and talk to everybody about their projects and ask questions. So now I will call up Dr. Harkins and Laguio. And would you like to share your thoughts about the project first, or would you like us to play the video first? Great.
Hey everybody. So we decided to do a video for our project, and that kind of was a product of really thinking about what one of the things that we had in common that we did early on in residency, and one of the things we bonded over and our friendship was built on, which was playing music. And we used to do just kind of ukuleles, and we would just jam and do whatever and sing, and nobody would hear us, and that would be great. But honestly, like, that was part of it. And then last year, during the time when we had the beginning of COVID, when research, RSPP was online, everything had changed a lot. We ended up kind of putting ourselves in the position of doing a roast video, and we really enjoyed doing the acting in that. Some people didn't enjoy it as much as others, but we enjoyed it, and it was therapeutic for us. And so we decided that in our way of kind of artistically expressing ourselves, we would kind of make a video and combine some of the music aspects as well as doing something a little bit more creative in a media format like this. So with that, I will let you guys know the song obviously is Hurt, and that's what we did. Right on.
I'm still right here. What have I become? My sweetest friend. Everyone I know goes away in the end. And you could have it all. I am fire and dirt. I will let you down. I will make you burn by the dark again. A million miles away. I wish you were now. I was fine.
I have to give shout out to Nick, who is back there handling Zoom in person. Thank you, Nick. Thanks. Yes, you deserve a clap. Okay, so now I'd like to call up Dr. Javahiran.
So during the pandemic, I think a lot of us picked up a lot of new hobbies, and one of mine, thanks to Ambreen Ahmed, was painting. So we painted this in one of our sessions together, and so I'm going to read my artist statement for you guys. So for me, the ocean is a place that has always brought me peace, even during the toughest moments in life. And I know that this year has been a difficult time for all of us, and the ocean is a place that has always grounded me, and that's where I've always gone to get peace. For me, looking beyond the water, I see where I came from and the countries where my family members still live. Standing in the shore, I'm reminded to stay in the present through the sensation of the sand, the water, and seeing the different types of marine life. Finally, the ocean is unpredictable, and so is life. Its waves are similar to life itself, fluid most of the time, but sometimes a riptide will come, and if you remain calm, everything will most likely be okay.
Next, Dr. LaGranger.
Alrighty. I did not do an artistic statement. Probably for the best of all of us that I didn't do something like that, so I stuck with what I know how to do. You can't totally see it, but I did a project called Decreasing Healthcare Disparities by Increasing Resident Involvement in Free Clinics. So basically, having gone to med school here, we have all of our CUP clinics, which I was really involved with as a medical student. And then starting residency, kind of realized that we weren't taking advantage of that as a learning opportunity, but also an opportunity to provide care for uninsured populations. Because unfortunately, we just don't see a heck of a lot of uninsured folks, especially on the outpatient basis. So working with Dr. Aldalami and some other folks, we wanted to create space in our curriculum for mostly our interns in one block that they do their intern year to have time to be able to volunteer and work at some of these free clinics. And so that was kind of the idea behind all of this. I did do some surveys, and that was like almost 2 years ago. I feel like the pandemic kind of changed a lot of these things. But basically just showed that most all of our residents were willing and wanting to work in free clinics and wanting that experience. So we used that kind of as a way to show that this would be a good thing. And then obviously it just helps meet our mission statement a bit more too in working with underserved populations and getting that sort of experience as well. So hopefully this is something that's going to kind of continue on after I leave. And that's about it.
Thank you. Next, Dr. Villacco.
All right, so when asked to do the scholarly project, having the option to do an expressive art piece was definitely exciting to me. And the prompt was essentially like, express yourself, think about the past year, think about 2020, what do you want to do? For me, it was hard to pinpoint one specific emotion for the year just because it was so dynamic in nature. And so I wanted to portray a lot of different emotions in one specific piece. I decided to do a multimedia piece where there are, this is scrapbook paper layered on top of each other, just as our emotions can be multifaceted and layered on top of each other as we're getting hit by wave after wave of cases with COVID. The bottom piece of the artwork is scrapbook paper that had some already printed watermarks, and then I added additional to that some grays and blues to portray tears falling on the paper to portray sadness and frustration. I then used acrylic paint and then watercolor paint to soak the paper. And so if you look at my piece on the back there, it's actually kind of crinkled from it being wet and then subsequently dried. The next emotion I wanted to portray was more of like anger, frustration, and so that is it was a red construction paper that I then subsequently painted fire on top of. I think that a meme that I commonly referred to was like it is fine meme, which I know I think a lot of you are familiar with, where it depicts a dog sitting in his home with his home up in flames with his coffee cup on the counter, kind of cross-eyed initially, and then when he looks at the next in the next cartoon box, he says, "It's fine." That's how I felt a lot of the time when I was working more like on the inpatient setting, working in the ICU, just kind of chugging through. And I think we had to put on, different faces for our patients, but then we were bottling up a lot of different emotions. Then the top part of the piece is more of grays, whites. There's also glitter. And so that's supposed to portray hope, faith, the positive of looking back at the year as well. Because when I think it's easier to look back at the year and focus on the negative emotions or the negative experiences. But also when I look back on the year, I also have a sense of proudness and a sense of proudness of myself, of our residency, of healthcare as a whole, stepping up to the plate. And so that's what it portrays.
Thank you. Next, I'll call up Dr. Maiolo.
April 19th, 2020. As an artist, it's not my job to tell others how to think or what a piece of art, quote unquote, means. It is also not my job to wait for feedback or find my own validation in whether others enjoyed my art or if they judge it to be brilliant, insightful, or meaningful in their eyes. Instead, I will seek to take everything that a piece of art is to me, take everything that I've been thinking about, what I hope that it will convey, everything that I hope somebody will feel the first time they meet the piece, and then everything that they will think about that day or in later introspection or analysis, everything that I'm feeling at the moment I made that piece, and everything I've experienced or thought about in life that brought me to the moment that I made that piece. Take all of it, compress it into one moment, put it out there for the world to experience, and then walk away. But before I leave, give that piece a name, so that if anyone ever wants to know what that piece means to me, the name of the piece holds the key to a place where we can always meet and walk together through that moment in time. Like friends walking together in the desert when spring blooms, because that piece is no longer who I am or what I will always believe. Just as the precious bloom of a desert flower, that moment is only most vibrant for a moment, and then it will fade away. But when the rain returns to the desert and springtime blooms again, perhaps we can walk together again. And if I find another cactus flower that can convey everything that I felt in its presence, I'll do my best to give it a name, so you always know where to find me. Can I say a couple more? This is all the things we think we know. So I can tell you what this piece is and how it was built and how it was constructed. And it is literally built to reflect light. It's literally built to reflect. So, I mean, I could tell you all the things that you see or you think you see when you look at it or what it means to you, but I don't know what your reality is. And right, our perspective and our experiences and our perception is our reality. So you can look at this piece and you could say, I see a cloud, or I see an iceberg, or I see a mountain, or I see an ocean, or I see the sky. And these are all things people have said they saw when they looked at this piece. And I say, well, it's none of those. I can also tell you it's not a visual depiction of, the words of Thoreau or of Percy Shelley and his momentous piece in defense of poetry. And it's also not an homage to Magritte and the School of Dadaism and their statements on life and surrealism and what it means to actually see and perceive things and think we know what we see. Because it's none of those either. Those were the things I was thinking about. Those are the things that I took in. And those are the things that were present when I created the piece. So I think at the end, realizing that throughout the entire last year, our experiences will forever build our further perception. And our perception is our reality. Thank you.
Thank you. And Dr. Ahmed.
All right. So my piece is called Lights in the Darkness. It was an acrylic on canvas piece because that's what I know how to do. So it's a monochrome painting. When I think about the last year, the first thoughts or words that come into my head are darkness and solitude. But then also along with that, I also think of light and unity. So, in this box, in this room, we have a few different figures, shades almost, embodying the darkness that a lot of us have experienced and harbored through the last year. But within each shade,
there's a glow of light. The size of the light varies depending on the person, meant to reflect our innate resilience. Some people's are brighter and some people's are dimmer. Some people fill theirs more frequently and some people's less frequently, and all of ours faded a little bit. But the thing that I really appreciate and reflect on most over this last year is how we were all lights in the darkness for ourselves and for each other. I feel like the level of companionship and self-care was really emphasized this last year. There was almost like an unspoken bond, even if we didn't go up to each other asking each other how we were doing every day, although that did happen a lot more frequently than previously. There was just this knowing of the person next to you is struggling similarly to you. And, you know, we passed by each other in the hallways on our morning rounds. We interacted with other specialties that were, you know, that were with us and other teams as well. And there was just this empathy that we all felt for each other. And so the thing that comes to my mind the most is the unity that we created, the team that we built that's strengthened over this last year. And I feel like we've come together a lot more than we would have otherwise if it weren't for everything that we went through. Yeah, that's all my notes. Okay.
Thank you. I'm trying to smize. Okay, so now we're going to call our panelists up to the table here, and Dr. Nair is going to introduce them. But we have 3 panelists to discuss the pieces.
Hi there, everybody. Thank you so much. So next, let me please invite Dr. Shirai, Dr. Muramoto, and Dr. Armstrong to please come up here and lead our panel discussion today. As a quick introduction, for those who may not know, Dr. Shirai is the assistant professor at FCM and the director of Artworks. Artworks is an outreach program at FCM and promotes community learning through creative and expressive art interactions. She will be actually talking today about the therapeutic value of art for health, and I will move in a bit. Next, we have Dr. Muramoto, who is the chair and professor at FCM. She will be talking about the role of family medicine's future in policy and practice. Finally, we have Dr. Armstrong, who is going to join our panel today. Dr. Armstrong is the clinical associate director and the clerkship director at FCM. He was actually extremely helpful in discussing the role of narrative medicine and actually met with the residents and us as well as we were trying to develop the artist statements. Today, Dr. Armstrong will talk a little bit about narrative medicine and the role of medical humanities for family physicians. So then you guys can take it away.
So if you turn on your, we could start from left to right. So maybe Dr. Shirai can start with a few comments, and then we'll move to Dr. Muramoto and Dr. Armstrong, and then we'll have some time for discussion at the end. Does that work?
Sure, yeah. Thank you so much for sharing all of your experience and beautiful piece and processes. I was very honored to be part of it. And I felt like I do not know the clinical setting because I'm away from the clinical setting, but then I kind of can peek through your experience and mind through the art pieces that you shared. And thank you so much. So I'm supposed to talk about the health and the art, the connection, but I think it would help to share what I do with the artworks because it's part of the family medicine and what art does for the population of people with intellectual disabilities. So we have an art studio and a gallery for and by people with intellectual disabilities. You may, provide support for them, but cognitively, communicationally, or behaviorally, they have a challenge. So the limited vocabulary and communicative tool, the art becomes really important. And I think we kind of share the same experience with the COVID that we are feeling or we are experiencing, but we just cannot grab the words to it. So in that moment, it's really helpful to have some things to express yourself or process or look at it, even you may not know when you expressed it. And someone was talking about singing in the moment, maybe Joey and Javier, that, you know, whatever the expression is, that is your moment of the emotions and feelings. And I think we have a beautiful, you know, the language and visual arts and music, and they have a different traits, right? So the visual art we can get to see and we can reflect upon, we can analyze on our own, right? Or we can share. And sometimes it's a scary thing. It's a commitment that you need to commit what you put on the paper. And I am a mover, and I'm not a visual artist, although I do facilitate the activity of creative arts. So I get very scared. I wouldn't be able to present my piece in visual art because I instantly, when I try to paint, I start judging myself. Am I doing correctly? Or is it pretty, right? So, so that uncomfortableness, sometimes the singing out loud in the shower can be the best things, right? It's a moment, no one is listening. It can go away, right? But at the same time, that you cannot share with others, right? Because the visual art you shared with us and some insight by the statement, we somehow shared the moment today to empathize and understand some of it, not totally, and we do have our subjective understanding, but we can share. But then sometimes you may need the momentum, just expression, like music does, or movement does. I just feeling so angry, so I just need to punch it, you know? So you can't have that, right? So you can kind of think through what your comfortable level is, but it comes to the people with disabilities and perhaps yourself. I can express myself with the movement. That's my background. It's comfortably. But it comes to the visual art. If someone give me the coloring book, that's my comfort, right? It's very therapeutic. But if I given a blank paper or a big canvas, I would freeze. So you think of that structure, how much structure for you to be free, therapeutic, and help you. And I think it's really depending on the person and their experience and comfort level. We can learn skill to do so. But I think as a clinician or yourself, as a monitoring your own health, I think it's good to know. So you cannot show your visual art. It doesn't mean you're not good at it, right? And some moment that I started working with artworks, I tried some visual art, terrified me. It was so uncomfortable, torturing 2 hours. It was a process painting, meditation kind of painting. But over time, I learned to how to enjoy it. So that skill can potentially come. But I think we kind of need to realize that art is all good is not the good things to say. Art has a variety of shapes and size and, you know, purpose and moments for the specific person. So I think it's great to include art here in the scholarly activities, but I think we need to acknowledge, you know, everybody has the different levels, different benefit and comfort. And then also art can be very internal for yourself. So I'm so appreciative for the scholarly project leaders to give you opportunity to not share or share. Because some of art, you know, if you transfer from your personal talk or process to the public, it's a different process and also different meaning to you. Sometimes you may not want to show that forever. That's just for you. Or opening up to the public may give you different perspectives, or you may have a connection to others. So public space can be a space for glow or connection and discovery for something new that you may did not think of before you started this painting or process. So some of the conversation we may have may expand what you have done on top of it, right? So something new and discovery that can happen. If you share the moment of creativity, we could have bring something new that yourself couldn't bring in. But that should be the choice of the person who made the art. And I just gonna stop that way because enough said. And so thank you so much. So do I supposed to individually comment on or no?
If you would like to, or you can pass it to Dr.
I mean, I have assigned a few, but then I think overall, I was very impressed by the art and I enjoyed art itself first. And I have some impression of what that art meant. But then when I was reading the statement, that gave me additional insight and flavor. And I was kind of experiencing in a different ways. So seeing the picture first and reading the statement and the hearing your talk today gave me 3 different layers. And that's the reflective kind of power of visual art, that you can really do that. So thank you so much for this opportunity.
Thank you, Yumi. I wanted to, first I'll say thank you to all the residents and the faculty mentors, and particularly the organizers of the forum today. This is something that's been different, and as Ivo said, this past year was different in so many ways. And I was asked specifically to talk around kind of the future of family medicine, with emphasis on the 2 more traditional type posters. But to me, as I looked at your pieces and read your artist statements, to me, all of them were really about the future of family medicine. And as I was thinking about it, the two posters, we're talking about the engagement with community and less underserved populations, and then also what the grounding and that kind of experience can mean to people that are moving forward in their residency careers, and bringing that into our residency activity. And I think that ties very much into the future of family medicine. As you probably know, there's a discussion going on right now about how are we going to revise our RRC guidelines? This is going to shape how family medicine graduate education is conducted for the next 10 years, which also means, since may sound like forever, but it's projected that when somebody graduates from residency, they'll probably more or less practice for another 40 years. So we're really talking about the impact for the next half century of family medicine as a discipline, and that's really the future. And one of the things that has come out in these discussions, both at the Starfield Summit, the discussion between the AAFP, the residencies, STFM, all the whole family of the family medicine organizations, was the importance of community and kind of doubling down on our commitment as a specialty to equity, health equity, and social justice. And one thing that I was struck with this year at the AAMC, American Association of Medical Colleges, was a statement that I've never heard out of that organization before. And that was, they've always talked about the 3 pillars of academic medicine being education, research, and patient care. And this year they added what they call the 4th pillar, 4th leg to the stool, and that was community engagement. And so I think in that I see a lot of hope, in that that's something that our discipline of family medicine is really uniquely positioned to move the field forward, to move healthcare forward, because of how you're trained. Our training is broader than any other discipline. We have this biopsychosocial perspective on things. So you're trained in the entire spectrum of care, from acute care, ICU, all the way out to ambulatory, public health kind of things. And then also across the the lifespan. No other discipline has that. And then another thing that I think really makes family medicine unique, which speaks a lot to the volume, the future, the brightness of the future, is your training also includes more behavioral science training than any other discipline, medical discipline other than psychiatry. So think about that for a moment, and how behavior and behavioral health really shapes not only physical health, but shapes really how we experience our lives and the quality of our lives and our relationships. So you, as the next generation, are really uniquely prepared to move healthcare in the direction it needs to go. And so in some ways, all your presentations were a love letter to the future of family medicine. There was a call in Dr. Barber's about leadership, if you look at her proposal. And I think you as the future family physicians and leaders of healthcare also uniquely positioned to be in leadership and leading your clinics, but also higher levels of leadership. And I hope you think about that and think about what you bring as, say, you were in charge of a healthcare system. You bring a breadth of perspective that no other discipline will bring. And understanding how the pieces fit together or how they should fit together if they're not fitting together. And that's something that you uniquely have to contribute. And then as healthcare gets more serious, I hope and I believe, about addressing social and political determinants of health, you're already thinking about community medicine and engaging with patients and communities. You know, your vision and your perspective extends well beyond the walls of the hospital and the clinic. And that's something that's really critical to contribute. Again, I don't see any other discipline that brings that perspective like out of the gate. And what does that mean? I mean, why should we care about that in academic medicine? And I'm writing a piece to make that argument. I want you guys to be the future CEOs of the hospital. You know, I would like to see a family physician be the CEO for Banner. That it will bring that kind of perspective and value and the ethos of health equity that I think you have to contribute. And so I'm hoping with the next generation of residency education, we start building those skills into your residency education so that when you graduate, you're prepared to start stepping into those positions to make a difference on a system level. You know, I believe you have it in you, and I really believe you are the future of our discipline in a way that is beyond how I think we've been thinking about it. I mean, the ability to be the change agents and really shape and drive how healthcare needs to move and how academic medicine needs to move. So I have tremendous faith in you. Okay.
Hi, everybody. I gave a very sort of hurried talk. This was a couple of weeks ago to the residents, but the faculty, I think, were mainly absent. So I'm just going to very quickly touch on some of the things I covered in terms of why narrative is important in medicine. So narrative, as you all know, is a spoken or written account of connected events or a story. And every human society, people tell stories. We often hear our first story, maybe even in utero, and we'll probably tell our last story just before we die. And in between, whenever people get together, whether it's one or two people or groups of people, they communicate through stories. And there's stories about all kinds of things: adventure, risk, good, evil, trust and fear, joy and sorrow. And I was very fortunate. I've always been interested in narrative, but I was very fortunate to study with somebody called Trish Greenhalgh at the University of London. I did a master's degree in international primary healthcare, and I did an elective in narrative. And she wrote this amazing book called What Seems to Be the Trouble that I'm sure I've probably shown everybody. and recommended. And she's also one of the people who started the movement to the narrative medicine movement in the sort of mid to late 90s. And just a backstory to this is that she was one of the people who worked with people like David Sackett, who were the founders of evidence-based medicine. And so she's not, she's got this extensive background, including evidence-based medicine. And she talks about how we learn what's wrong with patients by hearing their stories. And we also gain professional knowledge by sharing stories about sick patients. And very importantly, she says, narrative-based medicine complements the current dominant evidence-based medicine model. And she writes a lot about that. And what I spoke about is, I felt it was disingenuous for me to talk about how COVID has affected me, because I haven't been at the front line. So I spoke about my experience with HIV/AIDS, and how over history, various forms of pestilence and plagues and suffering have given rise to a rich body of literature and various forms of artistic expression. And I went through my experience with HIV/AIDS, starting with in 1981. And I've got the original copy of the New England Journal of Medicine. Before the internet, it's the paper copy that talks about this outbreak of pneumocystis pneumonia in people who were immunocompromised and they didn't know what was causing it. And then I've got the first Time magazine that featured HIV/AIDS, and on the cover it says, "Tracking the Killers, the AIDS Hysteria." And then very importantly, my mom, who was a remarkable person, gave me a book to read called "And the Band Played On, The Politics and People of the AIDS Epidemic." And the parallel here is profound. So he describes how the epidemic was ignored by larger society. And President Reagan didn't talk about it at all. And it was largely because it was killing gay Americans, hemophiliacs, and IV drug users. And it was only when Rock Hudson, who was this Hollywood icon and a friend of Reagan, died from HIV/AIDS, that he first mentioned it. So it was a confluence of an epidemic, social inequalities and injustice, political incompetence, and a lot of denial. And so I see a lot of parallels between that and what's happening with us. And then I spoke about my HIV experience in South Africa starting in 1986, and then I'm in Rochester, New York in the mid-1990s. All my patients with HIV/AIDS died from pneumocystis pneumonia, and the only retroviral we had was AZT. And then I also mentioned, I don't know how many of you have read or heard of Abraham Verghese. He's a remarkable writer and physician. He's the vice chair of medicine at Stanford, and he wrote an amazing story called My Own Country that I would recommend to everybody. And then I returned to South Africa in 2010, and by that stage, I worked at one of the hospitals where I trained, and by that stage, the prevalence among the general population was about 20%. It's the largest number of people living with HIV/AIDS in the world. In the internal medicine wards at this hospital, 80% of adults have HIV disease and or TB, usually both. 50% of pediatric admissions and 30% of women in prenatal clinics. So I sort of tracked my experience with HIV/AIDS. But most importantly, what I wanted to point out was that tragedy and injustice and feelings of powerlessness often give rise to creativity, which in turn engenders understanding, sometimes forgiveness, and sometimes healing. And I think that's, in a sentence, sums up what we're talking about today. And I briefly touched on my experiences growing up in South Africa during the really dark days of apartheid, but also talking about how apartheid gave rise to this plethora of, art, music, literature, that sort of opened a lot of people's eyes and also was instrumental in some ways to having change happen. And the last thing I wanted to just mention, this is we often talk about, should we be teaching literature to medical students and residents? This is a lovely book that I keep at my bedside called Medicine and Literature, written by somebody called John Selinsky. And he looks at all the old classics and links them to the lives of a family doctor or a doctor. And I'd recommend it to all of you. And I'll stop there.
So you each actually have a mic in case you want to use it. We were trying to be COVID compliant.
Okay. Oh, that's right. Okay.
But we didn't want to mess up the flow. So I don't know if the panelists have any other questions for the other panelists. If someone has said something that you'd like to comment on, or we can open it up to the crowd here, and if you have any questions or thoughts for the panelists or thoughts about the projects.
Question for the artist who did the art.
Will you use the mic?
This is kind of red, so. Oh, maybe I got it.
So I have a question to the folks who did the art. Especially for person who hasn't done much of art and tried this, and how does that felt for you? What was the experience like, or would you keep doing that or bring it back your day-to-day practice, or this is just because of the assignment that I did it? I wanted to hear.
I'm Connie. I was the first one to present. So I'll just speak for myself. In high school, I did art, and I did that as like a junior and a senior as one of my electives. And at the time, I actually thought I was going to be an art major. I was like, cool, this is exciting. I love this. I'll double major in art and biology and go on my way. I ended up not doing that. The liberal arts school I did, or I went to, had a really rigorous actually art program. And so I was like, I don't think I can do this with all the other things I want to do. So choosing to do an art piece for me brought me back to like a more kind of childlike time, even though that was high school. And it just helped me again, kind of reflect again on this like one patient that for some reason just like really stood out to me. Of all the patients we had all taken care of. And so it just felt really kind of grounding to do that kind of expressive piece and then reflect on this person that I can vividly see in my mind. So it wasn't a hard choice at all. It was really easy to kind of flow into that. I definitely do think it was a nice reminder of that time, and I'll definitely pick that up. And I did it with Embreen as well. So it was nice to like connect with someone else and sit down and just kind of do this kind of free form, it's very free. It's very liberating. So.
I could say that I'm sort of similar to what Connie was saying. So I'll say I'm kind of like what Connie was saying. I really don't do any artwork, and I haven't probably done any sort of artwork since middle school, high school maybe. But I found it very therapeutic. I also did it with Dr. Ahmed. Thank you. It's very therapeutic to be able to kind of put down emotions that you're currently feeling in your head onto paper, and how you depict those through colors, through shapes, through size through whatever it is. It's kind of cool to give your perspective and to see what other people's perspectives are on what you're actually drawing or what you're trying to depict. Kind of what Dr. Milo was saying, which I thought was a kind of a cool aspect.
For Dr. Muramoto, and it's related to Dr. Lagranger's poster and the idea of getting residents more involved in community charity clinics, community health. And so I wanted to get your thoughts, additional thoughts. You talked a bit about the AAMC's focus on community. How does that actually change, or how should that change medical student and resident education?
That's a good question. We were having actually a discussion at our table at lunch about, yesterday I went to medical school convocation, and one of the things they talked about was how the students were pulled out of, all their clinical clerkships. And in looking to stay engaged, although they weren't allowed in the clinical environment, the stories they told of being involved in various volunteer activities and trying to help out, engage with the community in any way they could. And they lost something in terms of their clinical education, but they also gained something that I personally believe will be very important going forward. And that is they got to engage with patients and communities around an important health issue and the impacts of that health issue in an experiential way that they would not have if they'd just life had gone on and we'd had enough PPE and they were all in the hospital or in the clinic. And my belief is once you see things like that and experience them, you can't unsee that. And that's what I think about with regard to our residents and you all that are graduating. Undoubtedly, COVID has changed everybody in profound ways. And it's a question of what are we going to make of that going forward? And I think all of medicine is asking that with the AAMC to say something about making it part of community. That might be, it's my hope that community medicine will have a greater emphasis in the next RRC guidelines. That's why it's so important, because that will be how residencies are accredited and constructed for the next 10 years, which means, that's really physicians for the next century. If you think about it, every graduating class going to practice for 40 years. It's got a very long trajectory into the future. So I'm really hopeful for that. I'm hopeful for the residency faculty and residents that were stakeholders that weighed in on that and saw the importance of community and connecting that to social justice and health equity. And the other thing we also talked about is one of the first things we jump to when we talk about doing something else is we don't have time for that. Curriculum's too full. I mean, we have this, our faculty, Julie, that works in the medical school curriculum. The curriculum hours are tight. They're too full. How are we going to fit something else in? Residency curriculum, same thing. It's full. How are we going to fit that in? And I would challenge us to be creative. If anything, this pandemic has taught us how to be creative. We've done things we never could imagine ourselves doing. And we found in some cases better ways to do things. We're talking about that at our table about in some ways a lot of this is just the way we do things kind of administration, in this crisis got stripped down to the really necessary stuff. And a lot of just fluff got stripped off. And so I would challenge us to think about and look at our residency experience through that lens. You have an amazing opportunity in front of you in merging the residency and looking at your curriculum. Is there a place to build in a longitudinal experience where residents are either working in free clinics or engaging in community? truly community engagement doesn't lend itself well to a 1-month rotation. Let's be fair. Really the impact in it and the experience is one of getting to know people and them getting to know you. And it's been done other places. And it doesn't add on to, it's like, how do you meet the RSC guidelines doing something that's really hands-on and experiential? It's not going to be about PowerPoints and didactics on teaching day. It's really going to be, getting into the trenches, rubbing elbows with people in the community. And I think it can be done. And I think it can be done in amazingly creative ways. That'll be just, frankly, way more fun, actually, and memorable than, sitting in a lecture and, listening to people like me. So I really encourage you to think about that. Those of you that are not graduating, this is a chance to really think outside the box of how you're going to put this together in a way that really builds in the community medicine piece.
Hello. Oh, God. I'm Mari Ricker. I know most of you, but I just want to say thank you to everyone who's shared these stories and pieces of art. Experiences are really powerful, and it just makes me think about how much healing we all have to do, and we have. And you've just shown us some really different tools that we can use to get toward that healing. I just get overwhelmed by the sense that everyone's ready to flip the switch. Vaccines are here, get the clinics back, get back to your RVUs. And there's been a lot of suffering. So thank you for this first step toward healing. And I hope that the other residents in the room from different years will take this as an example. And everyone uses sort of different tools, but this is just another set of things that we can use to kind of get toward a better place. It's not going to happen overnight, but we're on that journey. So thanks to all of you.
Hi, I'm Andy Bernstein. I'm not a physician, I'm a psychologist. And one of the tools, Mari, that I think people don't necessarily take full advantage of is each other. And I think it became very clear during this year how much people were able to heal and work with and grow and learn from each other. And just the breadth of what was presented today, whether it's talking about experience with an individual patient like Connie's, or the experience of a whole discipline, and what we need as family medicine, family and community medicine, the variety and the diversity in who we all are and what we can learn from each other, I think is stunning and is an important part of not only today, but certainly the last year.
Uma, I'm going to give this back to you. I broke my leg in December after surgery. I'm okay.
Hi, everyone. It's Ricardo with Family Medicine at South, of course. Anyways, just also want to thank you guys for sharing your art. It's not easy to share the things that you do, right? We're always shy and those kinds of things. I don't know, I just feel very inspired by you guys sharing all your stories, your art. I'm also, thinking about the future. I mean, I hope this is a consideration for the future classes as well, right? Like an opportunity for those that may not be that much into research. And there are people that are into research and they're great at it, but other people might find this kind of healing as well in art. So I hope there's an opportunity in the future and we don't have to wait for a pandemic to offer that opportunity to do those kind of scholarly projects. All right.
I actually had a question for Dr. Armstrong, which is not quite related to what we were seeing today, but you mentioned about your experiences with apartheid in South Africa. And it's an example of a lot of racial injustice that goes on in general. And so much of what, and it definitely involves disparities in health, which also involves physicians, and the work that they do. How much of that do you feel apartheid and the history of apartheid is actually going to be taught to kids in school and history books? Because a lot of the history that's normally learned is not uniformly spread out, and basically knowing where you came from will actually help you understand where you go. So from your experience, do you think it's going to be part of the history books?
That's a great question. So I'm actually constantly astounded. I'll talk to residents and even some colleagues about what my life was like, and there's no connection because they don't really know the history. And it's also interesting to see, even in South Africa, my dad was one of he was part of the first white delegation to go and visit the ANC leadership in exile in Zambia before the ANC was unbanned and before Nelson Mandela was released from prison. And a lot of those people came back, and their children are now going to very elite private schools, and it's more than 20 years beyond the first, free elections, and it's quite sad because their children don't understand what their parents were part of, and I still struggle enormously with it. And it's hard to even describe to people what it was like, and I still struggle with my sense of white privilege, even though I was part of a family that was very involved in fighting apartheid as best they could. And I worked most of my career in Soweto helping people who were suffering under apartheid, but despite that, I struggle to talk about it. I even recently was talking about Nelson Mandela, and I started crying. And they said, "Well, why are you crying?" And I said, it's not because I'm sad. It's just I can't believe that somebody who was in prison for 25 years and treated like he was so forgiving. So there's a lot of emotion. And I think that's relevant to the resident. If I'm still feeling like that, I was born in 1963, and the 1976 Soweto riots were when I was starting high school, and the height of apartheid was the sort of worst days was probably in the early 80s and late 80s. So it's a long time ago, and I still struggle. I don't know if that answers your question.
Yes, it does. Thank you so much for that. Do we have, okay.
I also just want to echo what Mari said to all of you guys for sharing with us today. I feel like this year has been a whirlwind, and a lot of us have not had a moment to sort of reflect on what has happened in the last year. And this has given me a little moment to reflect on everything that's happened in the past year. And one thing that I just want to say to all of you guys is how proud we are of the work that you guys have done this year. I think that this year has shown that family medicine is an integral part of the system, and that we can flex in different ways because of that broad training that Dr. Muramoto was talking about. And I'm so proud to see the work that you guys were doing for so many months before it was like recognized on a larger scale. And all of you guys. And I feel an immense amount of pride when I look at each of you in what you have done over the last year. So thank you.
Should we turn it over to Dr. Muramoto to wrap things up, just final comments, and then we'll have some time for everybody to kind of peruse the easels and talk to the artists and the residents and the researchers?
You know, it's kind of hard. I have to say I'm struggling a little bit to try to summarize or parting comments about what happened today. I think thinking about what everybody has had to say, you know, again, I want to say thank you to the artists for sharing with us, and the faculty mentors that helped them and how you helped each other, and then Uma and Julie for really flexing and coming up with this creative and really expressive and healing way for people to process what has happened in this past year. You know, COVID has been life altering. I have to say your work today also personally inspired me. What Connie was saying sort of tweaked a memory. I was actually going to be a fine arts major. It's still sometimes surprises me that I'm in medicine. And it was, again, family dealing with illness and sort of stuff that turned me in the direction of medicine. But absolutely, I was heading to be a fine arts major. So it's kind of re-inspired me that, you know, maybe I need to, I'm not dead yet, so maybe I could take a hand at it. I was very moved by your pieces, and you know, moved to tears. And it brings me also to, as I think personally back over the year, it says, as I said in my bulletin, that I just finished wrapping up the one-on-one meetings with faculty, the annual reviews, and I heard so many stories, stories that of the emotions and things that you've brought up today from the various faculty. And for me, this really completes a picture of what it was like for you as residents and learners. But you know, I heard stories of, you know, the anger, the frustration, you know, the fear, the sacrifice of going above, you know, the bone tiredness, yet one foot in front of the other to keep moving forward. And then the inspired creativity. And people, I heard stories not only of heartache and hardship, but I heard a lot of stories also of unexpected silver linings, you know, and I am an optimist. Some days you might not know it, but I am an optimist. And as I think about, the medical students yesterday, that experience of experiencing the pandemic from outside of the healthcare system, what will that mean to them? And what will it mean to you as we shape the future of our healthcare system? And so I'm hoping that will be a silver lining. And for our teachers, people that were mostly the way they pivoted their educational efforts, got really creative, and those that were delivering services or conducting research. You know, I'd heard those stories of silver linings. Hey, we've discovered a way that we would have never thought of, that we could reach people and make our services more accessible. That they said, if this hadn't happened, we would have never thought of that. You know, we had to be forced into it. But now it gave them some different opportunities. And then finally, there was a real thread among, just as I heard today, of kind of darkness to light, really that hope, that resilience, that, you know, light at the end of the tunnel that was more than, the vaccines were part of it, but I think it was that discovering that inner light, that resilience that people have, and the love and caring you showed for each other. And also, I really describe it as more, I would say there was a fierceness in the dedication to your work, to your loved ones, to your learners, the community. That personally was very moving and very inspiring. I want to say, what you've experienced, you can't unexperience, but I think in a lot of ways it's like tempering steel. You're stronger for it. You know things that you would have never discovered otherwise, and hopefully you'll be better for that. And I guess finally, just to say, I hope that what we've seen, what we've experienced, we can't undo. We can choose to forget, but we can choose to move forward and say, how do we take that and make the changes that are different in the world that we need to see? And I am incredibly proud of all of you. You really are the future. I'm incredibly proud of the faculty, both the ones in the rooms and the ones not, and how we all responded. And our staff too, not to leave them out. So with that, enough said. So thank you again.
Thank you. Thank you so much to our panel. And we have the room until 5 o'clock. And so feel free to mingle and talk to the artists and the researchers. And thanks for coming.